Mosquitoes, those buzzing, biting insects, have plagued humanity for millennia. Their existence dates back millions of years, with fossil evidence suggesting they existed alongside dinosaurs. Throughout history, mosquitoes have shaped civilizations and influenced human history. These tiny creatures have spread diseases, impacting populations and public health systems worldwide. Mosquitoes are not merely pests, but carriers of deadly diseases that continue to haunt us today. Malaria, a life-threatening disease, is caused by a parasite called Plasmodium. This parasite spreads through the bite of infected female Anopheles mosquitoes. When an infected mosquito bites a human, the parasite enters the bloodstream and travels to the liver. It multiplies in the liver and then infects red blood cells, leading to various symptoms. Malaria's impact is widespread, affecting millions of people globally. The symptoms of malaria can range from mild to severe. These include fever, chills, sweating, headache, muscle pain, fatigue, nausea, and vomiting. In severe cases, malaria can lead to life-threatening complications such as anemia, respiratory distress, organ failure, and coma. Understanding the transmission and symptoms of malaria is crucial for effective prevention, diagnosis, and treatment. Sub-Saharan Africa bears the heaviest burden of malaria worldwide. The region accounts for a disproportionately high number of malaria cases and deaths. Several factors contribute to the high incidence of malaria in Africa, including the presence of efficient mosquito vectors, a suitable climate for mosquito breeding, and widespread poverty. Limited access to healthcare, inadequate sanitation, and poor housing conditions further exacerbate the situation. The consequences of this disease are devastating. Malaria is a leading cause of death in Africa, particularly among children under 5 years old. It not only claims lives, but also hinders economic growth. The disease traps families in a cycle of poverty due to high healthcare costs and lost productivity. The impact of malaria on child development, education, and overall well-being is immense, hindering the continent's progress. Section 4. Beyond malaria, the threat of other mosquito-borne diseases. While malaria remains a significant threat, mosquitoes are also vectors for other serious diseases. These include Zika virus, dengue fever, chikungunya, and West Nile virus. Each of these diseases presents unique challenges and has the potential to cause widespread illness and suffering. Like malaria, these diseases disproportionately affect impoverished regions with limited resources to combat them. Zika virus, which gained global attention in recent years, can cause severe birth defects if contracted during pregnancy. Dengue fever, characterized by high fever, severe joint pain, and potential hemorrhagic complications, is a growing threat in tropical and subtropical regions. Chikungunya, known for its debilitating joint pain that can persist for months or even years, can significantly impact quality of life. West Nile virus, while often causing mild symptoms in most people, can lead to serious neurological complications in some cases. Section 5. The ripple effect: how mosquitoes impact our world. The impact of mosquito-borne diseases extends far beyond individual health. These diseases have profound economic, social, and developmental consequences, particularly in low-income countries. The burden on healthcare systems is immense, straining resources and hindering access to essential services. The economic losses due to illness, disability, and premature death are substantial, impacting national development and perpetuating poverty. Moreover, mosquito-borne diseases can hinder tourism, disrupt trade, and affect agricultural productivity. The fear of outbreaks can lead to travel advisories, impacting local economies and discouraging investment. The social consequences are equally significant. Communities affected by these diseases often face stigma, discrimination, and social isolation. The loss of human capital due to illness and death has long-term consequences for education, workforce participation, and overall societal well-being. Section 6. Fighting back. Strategies for prevention and control. Despite the challenges, there is hope in the fight against mosquito-borne diseases. A multi-pronged approach is essential, combining vector control, treatment, and public awareness. Vector control reduces mosquito populations and limits contact. Strategies include mosquito nets, spraying, and larval management. Early diagnosis and treatment are crucial. Vaccines for malaria and dengue offer hope. Public awareness campaigns educate communities. International collaboration and innovation are key. Together we can combat mosquito-borne diseases.